Every stroke, every concussion, every case of Alzheimer's follows the same three-phase biochemical cascade. Yet almost no one in medicine is targeting it. Understanding this sequence is the difference between watching brain damage spread and actually stopping it. We've made almost no progress treating brain injuries in the past 100 years. That should disturb you. A patient walks into the ER after a concussion. The doctor checks pupils, asks a few questions, sends them home with instructions to rest and take Tylenol. That's the same advice we gave in 1925. Meanwhile, inside a patient's skull, a biochemical wildfire is spreading cell by cell. We have MRI machines, CT scans, clot retrieval procedures, but we still have no clinical treatment that actually repairs damaged brain tissue or stops destruction in progress. The standard of care treats symptoms while ignoring the fundamental biology of how brains break. If you've ever been told, just rest after a brain injury, this video will change how you think about recovery. Phase 1, the free radical flood. Within seconds of a brain injury, your own cell membranes become weapons that attack neighboring healthy cells. When a neuron is damaged, whether from the impact, a stroke, or disease, its membrane breaks open. This releases highly reactive molecules called free radicals into the surrounding tissue. These oxidants don't just sit there. They attack the membranes of the neighboring healthy cells, causing them to rupture and release more free radicals. This is why a small initial injury can become a much larger area of damage over hours and days. The destruction is self-propagating. Without intervention, your brain's own chemistry extends the injury far beyond the original impact zone. The first phase requires immediate antioxidant intervention. Most people receive none. Phase 2, excitotoxicity, when neurotransmitters become poison. Glutamate, it helps you think, learn, and remember. But after a brain injury, it becomes one of the deadliest neurotoxins. Glutamate is your brain's primary excitatory neurotransmitter. Under normal conditions, it's safely contained within the cells. But when neurons and glial cells are damaged, glutamate spills out into the extracellular space. There it binds to receptors on healthy neurons and triggers a cascade of calcium influx that kills them from the inside. This excitotoxicity is why brain injuries often worsen in the days following the initial event. The patient goes home thinking they're fine, while inside the brain, glutamate is systematically destroying cells that survived the original impact. This phase can be blocked. Understanding excitotoxicity explains why some people never fully recover from minor concussions. Phase 3, the inflammatory storm. Your brain's immune system response is supposed to clean up damage. Instead, it often makes everything worse. Hours after the injury, the brain mounts an inflammatory response. Microglia, the brain's immune cells, activate and release cytokines and chemokines. Blood vessels dilate, the blood-brain barrier opens, immune cells flood in from the bloodstream, bringing more inflammation, more free radicals, and more cell death. Controlled inflammation is necessary for healing, but in brain injury, this response often spirals out of control. The same cytokine storms that made COVID-19 deadly occur in your brain after trauma. Without intervention, inflammation perpetuates the destructive cycle indefinitely. Neuroinflammation is why symptoms can persist or worsen weeks after the initial injury. Why no single drug will ever work? Pharmaceutical companies have spent decades searching for a brain repair drug. They're looking in the wrong direction. The neurodestructive sequence involves oxidation, excitotoxicity, and inflammation occurring simultaneously across multiple biochemical pathways. A single drug cannot address all three phases, and that is why every Alzheimer's drug trial has failed. This is why we have no pharmaceutical treatment for traumatic brain injury. The one drug, one disease model that works for infections like strep throat and antibiotics doesn't work for the brain. Neurologic recovery requires a multifactorial approach, multiple interventions targeting multiple phases of the destructive cascade simultaneously. The brain is an orchestra, not a single instrument. Stop waiting for a magic pill. The science already exists to interrupt this sequence. The sequence can be stopped. We cannot undo impact, but we can stop the cascade that turns minor damage into major disability. The neurodestructive sequence follows a predictable pattern. That predictability is actually good news. It means that we can target specific intervention points, antioxidants to scavenge free radicals, compounds that block glutamate receptors, and natural anti-inflammatories that calm the cytokine response. These interventions exist. The difference between someone who recovers fully from a concussion and someone who lives with brain fog for years often comes down to what happened or didn't happen in the hours and days immediately following injury. Early intervention changes outcomes. Every contact sport athlete, every stroke risk patient should understand this sequence before they need it. So why does this matter? The neurodestructive sequence explains why brain injuries worsen after the initial event, why degenerative diseases progress relentlessly, and why conventional medicine has failed to find cures. Understanding this three-phase cascade is the first step toward actually repairing the broken brain, not just managing symptoms while damage continues to spread. For almost 40 years, I've worked with patients who were told nothing more could be done. I've watched them recover functions that conventional neurology considered permanently lost. The difference wasn't a miracle drug. It was understanding and interrupting this fundamental biochemistry of how brains break. If this changes how you think about brain health, subscribe for more on neuroprotection and neurorestoration, and share this with anyone who's been told just rest after a head injury. And if you want to understand the repair side of the equation, how brain actually rebuilds itself, that video is coming next. Your brain wants to heal. We just need to stop getting in the way.